Morning Show.
It's great. We have a very special guest.
Yes.
Let's bring him into the mini mansion right now. One of the most premier plastic surgeons in the world, Dr. Ghavami.
That's right.
And he's bringing in Jody, one of his patients.
That's right. Hi, Dr. Ghavami.
Hello.
Welcome to the show. It's a pleasure having you in.
Thank you. Thank you
So,
very much.
I know you're good at everything in all things plastic surgery, you know,
Thanks.
face, breast, body, but Dan's girl has been thinking about getting a boob job for a while.
Right.
Yeah?
Correct. And there's so many different kinds of procedures now.
Yeah.
I know, like, there's silicone, there's saline, but isn't there?
There's gummy bear.
Yeah, I don't know about the newer options.
You know, there's a lot of options, and a lot of it has to do with the profile. So basically, you can have, you know, the San Gabriel Mountains or the Himalayas. You know, so
She wants a natural look.
Okay, so
Yeah,
San Gabriel.
yeah, San
okay.
Gabriel. That's
All right.
Local mountain range here in SoCal for those watching on the other side of the country.
She doesn't want Nepal.
Okay, okay.
She wants to like some rolling hills.
Yeah, I usually don't like those either. So, you know, it's all about measuring the tissue and the dimensions of the person and matching it to that. So in general, I tell people, imagine if Mother Nature wanted you lactating, how big you would be. That's kind of what your destined size max is. And I can do that based on the measurement system I've developed. And also, you have textured surfaces, you have smooth surfaces. I don't like textured.
What do you mean by textured? Like the
it's like
implants and stuff?
sandpaper outside. It's coarse, so it sticks to the rib cage, so it doesn't move around like natural breast. So I don't like those. Those are better for like cancer reconstruction.
Okay,
in my opinion.
So the texture is not for anyone feeling the breast. It's just to adhere.
Yeah, but they tend to be a little firmer. So
Firmer.
I don't prefer those unless somebody is getting a major reconstruction.
Do you go with silicone, saline? Do you use both?
Silicone's always best, but you know, right now the FDA has this weird rule that under the age of 22 you need to get saline. So that's kind of they just developed some. They think the breasts completely stop growing that age, although they stopped growing before that. But it's just this safe rule that they.
Yeah, my boobs have been the same size for a long time.
Really, really.
Oh yeah.
Now silicone. Years ago, there was problems, like many years ago.
It
with
got
some
a bad rap.
Bad rap. But like the newer ones, they would not, I guess leak is the right word.
Yeah,
it's like a different kind of
substance.
yeah.
Well, we're on 4th and 5th generation implants
okay.
now. Those first generation ones from the 70s,
Yeah.
80s, the silicone inside was like vegetable oil. It wasn't like this cohesive thing. That's why they call them kind of like gummy bears. If you cut it in half and you hold it upside down, it doesn't leak to the floor.
Oh, so it can't break down and go into the body.
It can over time. The rupture rates are really low and they're microscopic.
Oh,
and,
okay,
and they don't cause the big mess they used to. Plus, the outer shell's stronger.
Okay,
They're just
many
phenomenal
advancements.
space-age things right now.
And why do you like those? Do you like the feel of those? You think
Silicone tends to kind of conform and feel more like breast tissue.
That's right.
So you can trick your boyfriend.
Yes.
Okay.
You know, it's so funny because squeezing girls' boobs 10 years ago, I was like, oh, that's. But lately, I'm like, oh my God, this feels like a real boob.
Yeah.
It's incredible.
Yeah.
But you're saying it's not one size fits all. You
Definitely
really
not.
kind of play it by ear per patient.
Yeah, you know, I don't want to criticize my colleagues, but a lot of people just kind of do this reflex response. They put huge implants in everyone.
Right.
And some people, they're not destined for that, you know? And what happens is it might look good for a year or two. You go to Vegas pool party, sure, you get attention. But 5-10 years down the line, your breast tissue thins out. You see the crepey skin in the edge, the ripples, and it damages your muscles. And then they end up being like the rocks in a sock.
See, I brought you the expert, Dan, because I know
know
you had questions and he has answers.
I know. I love it. Now, we have pictures. Let's see some pictures of some of his work.
Dr. Ghavami's work.
I was on his website the other day. No, Ghavami Plastic. Yeah, GhavamiPlasticSurgery.com. They're amazing.
This is a nose. We're not even talking about noses today, but I mean, you completely changed her face. That doesn't even look like the same person.
Yeah, she's so gorgeous right now.
Yes.
And she comes in with her hair done and makeup. She's a beautiful, tall, very well built, nice curved woman.
I mean, that's absolutely flawless. Now, wow, Dr. Ghavami, what did you do here?
Wow.
So this is, of course, the famous Brazilian butt lift. I call it S-curve butt lift. But the thing with this is I've been doing this for over 10 years.
Yes.
There are people now that it's blown up because of Kim Kardashian.
Yeah.
Yep.
I liked this back in the days of Vita Guerra and J-Lo. I've always thought butts were important since I was a teenager.
Yeah.
Okay.
You know
So
what's up.
right
It's a
now
real
it's
man.
become this huge phenomena. So I'm fortunate to be lecturing around the world on
Thank
it.
God for that after picture.
And so what you do is you take fat from everywhere that doesn't look good and you put it in the buttock. So you can really shape a woman's buttock
mean,
nice.
Dr.
That's
Ghavami, this
amazing
is
that it's the same
literally
person.
night and day.
Yes.
Yeah.
And it changes relationships. That's what's
I
interesting.
bet.
Oh my God, it's
I mean, guys are visually stimulated.
Yeah.
That picture on the right, I mean,
I mean, just for me alone,
wow.
my man's been working out really hardcore lately.
Yeah.
And his body's gotten so much better, and I feel like I'm cheating on him with him. So it's kind of like the same thing.
It is that. A lot of things
happen.
happen.
You go into surgery, and it's like, ooh, it's like a new person, but it's still them.
Yeah.
It's amazing.
But it does require security and confidence, because I've seen people get married and engaged left and right after I do surgery on them.
Really?
There's something that happens with their confidence. They exude this confidence.
Yeah.
But if the partnership is not strong, what I've seen is that it can cause insecurities to blossom.
Kind of like that question we got in Tough Love.
Absolutely.
Interesting.
Yeah, people get insecure about it. Yeah.
Yeah, that's so bizarre.
And the
But it
mommy
enhances sex life for sure.
Oh, I bet. Of course.
Even if you're insecure, it's like angrier sex. But it's still good.
And again, go to this website. It's GhavamiPlasticSurgery.com. Check out the mommy makeover gallery. I checked out that. It was unreal.
It's mind-blowing.
The before and the after.
Thank you.
Because you did like multiple procedures.
Yeah, and these are great because they're moms. You know, they had kids.
Yeah.
And sometimes they don't feel as sexy anymore because skin is loose, breasts have sagged. Then you go, I like to call it Ghavami mommy because I always include the butt.
I love it.
So we do the fat to the butt thing, get them curvy again, get that butt plumped up.
Yeah.
And then we have breast implants or breast lift, and then a tummy tuck to tighten those muscles like a corset.
Oh, wow.
So like the whole body goes back sometimes to better than before kids.
So when you're rebuilding these butts, are you putting implants in there, or is it literally a fat transfer?
I don't like putting implants in because over long term, it doesn't feel right to constantly be sitting on two big wallets.
Yes.
Because they get hard.
Ooh.
So I prefer fat, the body's own tissue. Fat is like liquid gold. It has stem cells in it, and it feels great on the buttocks.
Exactly. I'm building my wealth. I'm wealth building right here. This is healthy. This is healthy.
So tell us about the 24-hour Flash Recovery Breast Augmentation, because I think this is what is the most baffling to many people, and why a lot of women don't get breast procedures because they don't want to be able to not do anything for so long. So how does this work? How's it even possible?
It's an awesome procedure because, first of all, breast implants should be under the muscle. So this is under the muscle, so let me clarify, because a lot of my haters, they say, oh, he's putting it over the muscle. Of course it's quick. There's no bleeding. We go under the muscle, between the ribs and muscle. I don't cause any bleeding. Blood needs to stay in the vessels. If blood leaves the vessel, think about when you get a bruise, how much it can hurt.
Yeah.
So if you have no bleeding during the surgery, you sneak the implant in and out, and you don't go too big like we talked about.
Yeah.
Patients can lift their arms up in the air right away and go back to work in a day or two.
Wow.
And I tell them to go out to dinner the same night, and I don't prescribe Vicodin narcotics, just Motrin. So I have CEOs and dignitaries from the world, playmates, models, everyone from all over that come.
Yeah.
Because they want to go back to their life. And I have dancers, not ballet.
Yeah.
But dancers that
the
come.
exotic variety.
And they go in like, you know, as long as they don't use the pole, they can go back within like a week.
Dan, I think we might have found your doctor.
I know this
I'm
is
telling
amazing
you, he's
for
the
my
bomb.
girl. And let's bring in Jody. This is a patient that had this procedure.
Yes, she did. Oh, hello.
Oh my God, she's beautiful.
Are all of your patients amazingly hot? Well, I guess you are in Beverly Hills, so you get the best of the best.
Yeah.
So you've had the procedure. What size were you before?
I see.
You were.
I had a lot of fat in my boobs. They look amazing now.
Can we see how the after?
Yes, this is gonna be fun.
Okay,
and we can just have you grab
so she did have the 24 hours. So we had her arms up in the air right away. It's like
oh my
motion.
gosh,
this is ridiculous.
Beautiful.
And what size is she now, doctor?
Double D.
She's a double D, and they look so natural. Honestly, and I'm not just saying this because you're sitting right here. I would not have guessed those were fake.
Yeah.
Want to feel it?
Go, Andrea, go.
Okay, I'm going for. Yeah, you can come to me.
I'm gonna live vicariously through you right now, Andrea.
I'll tell you how amazing they
you
feel.
report back.
Oh my God, they feel like mine.
They're awesome.
But
that's
way
the beauty
bigger.
of silicone.
Oh my God.
Wow.
Those are fake? These are fake? Okay, Doc.
I don't like the word fake. I like to say blessed.
Blessed. I love that.
Those are blessed. They
Yes.
are blessed. Those are, Dan, you're going to have to feel those off camera after the show. Because
I'll check in with Jody.
That was amazing.
Yeah.
Those might be the best boob implants I've ever felt in my life.
Well, I mean, she's a good candidate. You know, when you start with a good canvas, you end up with an amazing canvas. So.
Now, do you recommend, like, what do you mean by that as far as, like, candidates and stuff?
You know, there's some patients, women have really saggy breasts, so they need a lift.
Right.
There's some people, they just don't have symmetric, good tissue, or their tissue's kind of, like, thin.
But you can work with all of that.
They all, Breast implants, like, change lives.
I do have a question for you because a couple of my friends, maybe John's chick, have nipple rings. When you do procedures, do you have to take the nipple rings out?
Yes, we do, but you can tape them if they really can't come out. But you take them out, you can put them in right away, so the hole doesn't close.
Cool. Wow. Because I know it's like one of my girlfriends was kind of concerned about that. Well, I know your chick has one first, right?
Yeah, she does.